Depression, the silent enemy that could be closer than you think. What is depression? Depression is a serious mental condition that goes far beyond moments of sadness or feeling down. It affects millions of people worldwide, often silently, eroding emotional, mental, and even physical health. Have you ever stopped to think that someone close to you might be fighting this battle without you even noticing? That's what depression is, a silent enemy that can go unnoticed but has devastating consequences if not diagnosed and treated in time. What causes depression? Depression can be triggered by multiple factors, and the causes may vary from person to person. Biological factors, such as chemical imbalances in the brain, can be one cause. There are also psychological and environmental issues, such as childhood trauma, excessive work stress, relationship difficulties, or the loss of a loved one. Genetics play a significant role too. If someone in your family has suffered from depression, your risk of developing the condition increases. What are the symptoms of depression? The symptoms of depression are varied and can affect people differently. Some of the most common signs include persistent feelings of sadness, emptiness, or hopelessness, loss of interest in activities once enjoyed, constant fatigue and lack of energy, changes in appetite and weight, sleep disturbances, either insomnia or oversleeping, trouble concentrating, feelings of worthlessness or excessive guilt, recurring thoughts of death or suicide. Recognizing these signs early is crucial to ensuring that the person receives the necessary help. What types of tests are used to diagnose depression? While depression cannot be diagnosed with a blood test or MRI, there are clinical assessments that help identify the condition. Psychiatrists and psychologists use tools like questionnaires and structured interviews to evaluate a patient's symptoms. Additionally, lab tests may be conducted to rule out other medical conditions, such as hormonal imbalances, that could contribute to depressive symptoms. What are the treatment options for depression? The treatment of depression typically involves a combination of psychological therapy and, in many cases, medication. Psychotherapy, especially cognitive behavioral therapy, CBT, has proven highly effective in treating depression, helping people identify and change negative thought patterns. In some cases, group therapy and activities that promote well-being, such as physical exercise and mindfulness techniques, are also recommended. What medications are used to treat depression? Antidepressants are often prescribed to treat depression. The main types include selective serotonin reuptake inhibitors, SSRIs like fluoxetine, sertraline, and escitalopram, serotonin and norepinephrine reuptake inhibitors, SNRIs like venlafaxine and duloxetine, tricyclic antidepressants, TCAs like amitriptyline and nortriptyline, used in more resistant cases. Monoamine oxidase inhibitors, MAOIs like phenelzyme, recommended for more severe cases. What is the dosage of each medication for depression treatment? The dosage of antidepressants varies depending on the type of medication and the patient's condition. Here are a few examples. Fluoxetine, typically 20 mg per day, adjustable up to 60 mg per day, depending on the response. Sertraline starts at 50 mg per day, with gradual increases up to 200 mg per day. Venlafaxine, initial dose of 75 mg per day, with the possibility of increasing to 225 mg per day. Amitriptyline begins at 25 mg per day, which can be raised to 150 mg per day, as needed. It is crucial that these medications be prescribed by a healthcare professional and that the treatment is closely monitored, including follow-up visits for dosage adjustments. If you recognized yourself in any of the information above or know someone who might be suffering, know that help is within reach. Click like and subscribe to our channel to stay informed about valuable content like this. Your mental health, or that of someone you love, may depend on information like this. By subscribing, you'll always have access to tips and guidance that could save lives and help pave the way to recovery.